Hi guys, good afternoon, good evening, good morning, depending on what time you are watching this, depending on where you are watching us from. But it's a pleasure to share my journey with you. For those that will be watching me for the first time, I'm Florence, and I do share my journey of life abroad, life overseas, because I'm from Africa, I'm from Zimbabwe, and I moved to the UK 2 years ago on a skilled worker visa. So here we do talk about life in the diaspora, moving abroad, culture shock, raising a family in the diaspora, because I'm a mom, I'm a wife, and I'm a healthcare worker. So I have been sharing my journey. I've been dropping in a few tips, a few hints, and insight into how I do certain things, taking you through the process and everything. So today's video has been inspired by a number of questions that I got after yesterday's live. Thank you so much for those that are always supporting us, always following, and those that are subscribing. A big shout out to you, and thank you so much for all that you do to support us, to support the work that we do. And the reason why we do what we do is just to try and inspire somebody, just to try and bring awareness that there is life outside all the other things that we do, and it is still a career that is rewarding, the care job, which is what I do. So today, after yesterday's live where we spoke about how I applied for a job within the NHS and I landed that role, so I took people, just a bit of a background recap. Yesterday we spoke about how I applied for a role with the NHS, the application process and everything. And thank you so much for joining us. Thank you so much for all the support as always. Today I'm talking about how I applied from overseas to come to the UK on a care visa, how I applied for the job. So there is actually two ways in which you can actually apply for a job overseas. Nolin Chingwete, thank you so much for the support. Thank you so much for watching. Those that are joining us, guys, kindly share with your friends, tag your friends, share in your groups, share with your community. I mean, we are just here to help people who are actually on this journey to relocate. So for those that are watching me for the first time, I moved to the UK 2 years ago on a healthcare visa, and I'm enjoying it. That's why I think I've decided, like, well, I'll take everybody along on my journey. So today I'm going to go through how I applied for this role from overseas. So I was actually saying there's two ways in which one can apply. One is through, maybe you've got somebody has actually shared with you a link to say there's a company that's recruiting, or somebody has actually given you an email to say, well, just try this email, they are recruiting. The second one is whereby if you go, most companies, especially those big companies or recruitment companies, what they do is they have got their own customized recruitment form in which you are going to fill in the details according to their policy, according to their format. So we will talk about that in another video. Today what I'm going to talk about is, suppose you've actually got a list of companies or a list of emails to say, well, just try them, because that's what I did. I got emails of of colleagues. I had like a long list. For those that do follow me in what my videos, they know, like, I used to apply like 50 applications a day. That's how much I wanted this. So here's what I did. One of the things that I realized are very important is what they call a cover letter. So you're given an email and you're going to send an email. You cannot just like say, please find attached CV. CV about what? Why are you sending that CV? So one of the things that are important is a cover letter, because it gives whoever who is going to read your email or is going to read your CV a sort of like background idea of who you are and what you're about. So it was one of the things that I did, and I did my own cover letter on my own. So I'm sure if you are watching today, you also should be able to come up with your own cover letter. So we are just going to go into detail how I managed to put together my CV. And remember, guys, I was still in Africa and I was just trying my luck abroad, and thank God it worked out. So I will today, again, just like yesterday, I'll be looking down a lot, because I am going through my laptop and I'm going to share with you my cover letter and how I applied. So I'll read through my cover letter. So this is how I structured. So I would put the email address for the company. Suppose you got it off their website or off, the long list. If you're in Africa, if you are somewhere and you're trying these jobs, you know what I'm talking about. So you've got your long list. So this is how I came up with my cover letter, and I'll go through it with you. So I would put in my email address, just the usual way you write your emails, and then I would say, dear recruitment manager. Why I do say that is because it's a way of like being respectful, because you don't know whether it's a man or it's a woman. So you can't say dear madam or so. For me, I just went dear recruitment manager. And there goes my cover letter. It is with great interest that I present my CV for the position of a healthcare assistant within your organization. I strongly believe my profile and personal qualities could be a perfect fit for your team. Those that were watching me yesterday, I said when you are given a chance to write a cover letter or to write a personal statement, it's your chance to showcase who you are. It's that time where you get to write about you. Aside from your CV where you put in your qualifications, this is the time for you to say something about yourself, something convincing, something nice, something that if one can actually read it, they'll go like, well, I want to speak to this person. Why I do say that is because I think if you've watched my videos before, I said by the time I got my certificate of sponsorship to come to the UK, I had 3 companies that wanted to bring me over to the UK, and these were free companies. I applied to them, I didn't pay anything for that, and all 3 companies wanted to bring me to the UK. So when I do say put in the work in your cover letter, put in the work in your personal statement, I know what I'm talking about, and I know this does work. A big welcome to Danai. Thank you so much, my dear. Thank you so much for the support and for the encouragement and for all the prayers. I do love you. So guys, tag your friends, share with your friends, because this could help somebody. And what we are doing, we're not doing it because we know so much or we're experts. No, we do because we are on a journey, and we do believe a lot of people will get help. So you could be back home in Africa and you want to try this journey. Probably it's worth watching this video. You could be in the UK, but you're wanting to switch to a different company, a different carer altogether. This could be worth watching as well. So share with as many people as you can. So guys, I'm just taking people through my cover letter, what I used to apply when I was back home, and I still even use it now in the UK when I do apply for certain roles, be it part-time jobs, I just use this. Of course, I do tweak it a little bit and stuff, but this is what I used when I was coming from Africa. So I went on to say, I strongly believe my profile and personal qualities could be a perfect fit for your team. I love teamwork. I love whenever I get a chance to speak of how I can work in a team, guys, I would just pop it in. Why do I say that? Rarely do you find organizations where it's just one person. Definitely you work with a team, and your ability to fit in a team is one of the qualities that anybody would want. If I was an employer, if I was a recruitment manager, definitely I would look for a team player to join my team. So I went on to say, I'm an overseas healthcare assistant with experience in hospital care and private home assistance. Guys, it's important to build your experience. So while you're waiting, those are some of the things that you can do. Build your experience. It's very, very important. Volunteer. Well, I'll mention a few ways in which you can build experience through actually finding a job related to how you are gonna move to the UK. So it's worth it. Suppose you're training, whether with Red Cross, St. John's, whatever institution that you could be applying with, always make sure you prioritize or you give yourself time to go for an attachment, even on part-time basis. A big shout out to you, Matthias Sadiq, my brother. Thank you so much for the support. I do love you. So today, guys, we are talking about how I applied for a healthcare assistant role whilst I was in Africa, and applied in the UK, and it worked for me. So it could work for somebody. So I went on to say, I have got experience with hospital care, private home assistance. Why did I put in that? It's because I did my training with Red Cross, and for Red Cross to give you a certification, you need to have done at least a minimum of 3 months attachment. So I had done that, and it was worth putting in my in my cover letter, so I did put that. I also had experience with private home assistance. Why do I love to drill down on this? Is because I'm sure if you're African like me, definitely you've got experience looking after somebody, looking after a relative, looking after a neighbor, looking after a friend. That experience is very key. It's just that maybe when we are back home, when we're in Africa, we don't look at it as valuable experience. But I'm telling you, it's valuable experience. Why? I think I mentioned it in one of my videos or in one of my writings where I said I think probably I was just destined from day one to be a carer. Why? Um, I think when I was round about 13, somewhere there, I did look after my grandmother, or may her soul rest in peace. But by that time, I didn't know what it was about. We were just like, okay, we're just looking after Gogo. I didn't realize how that would contribute to what I am today, my passion, and how I am embracing the path that I've chosen. Along the way, I think I got married, and then I got a chance to look after my lovely mother-in-law. May her dear soul rest in peace. Oh, that when I was doing it, it was just like I'm looking after family. That's what we do. But little did I know that probably it was God's way of preparing me for what I do now. And I want to be very honest with you. When I would get a chance to be interviewed, I always mention that experience because it's so close to me, it's so relatable to me, and it's only now that I'm in this profession that I realize like I do have experience that goes as far back as when I was back home. I also did a bit of volunteering with a different organization when I was back home, so it's worth mentioning. Whether you've got paid experience, you've got voluntary experience, you've got that personal family experience, always try to factor it in your personal statement. Do not shy away from mentioning that because experience is experience. For as long as it's relatable to the job that you're applying for, do mention it. So I went on to explain that experience I mentioned in the top. I said, I've cared for elderly patients in their day-to-day needs and also children with physical and learning abilities. So care is quite broad. It can span from like looking after the elderly. Why I'm trying to explain this is because you could be in Africa just like me, and I didn't realize like this career is so broad. It goes as far as looking after the elderly in their old age. Looking after it could be like children, young adults with learning disabilities. When we do talk about learning disabilities, we talk about like Down syndrome, autism. I'm trying to think of other, but there's a whole spectrum of learning disabilities. So if you do have experience in that, put it in your cover letter, put it in your CV. It's worth putting it in. So I went on to say, this experience has developed and solidified my caring competencies and interpersonal skills. It's very important to acknowledge what you learn through experience, what you become through the experiences that you face in life. So I wanted to mention that experience had solidified my caring competencies and interpersonal skills. When you talk about interpersonal skills, those are the soft skills that one can have that can vary from communication, teamwork, conflict resolution, decision making, being someone who is compassionate and caring. It's something that you can acquire based on what you would have been like exposed to. So those are the interpersonal soft skills that I mentioned in there. So I went on to say, well, I'll read this statement again so that someone will get where I'm going. It says, this experience has developed and solidified my caring competencies and interpersonal skills, especially around reliability, empathy, and building strong, trustworthy relationships with all kinds of clients. Guys, if I can take you maybe ahead, probably we'll talk about this, like how to survive in the care industry. One of the things that are important is your relationship with the people that you look after. I think if you're going to be successful, if you're going to love the job, if you're going to enjoy what you do, definitely that relationship is very important. Yes, relating with your teammates is important. Relating with maybe other people that you work with in the organization is very important. But one of the things that is very, very important and that you should bear in mind in this job is the fact that we wake up every day to go and look after the people that we provide the service to. So basically everything that we are doing is about them. So building those relationships in a professional, trustworthy, transparent way is very, very important. And so it takes effort, it takes intention, it takes skill, it takes competence for you to be able to forge those professional relationships. Why? Just like any other relationship, it doesn't just like start like a house on fire. It takes effort. Sometimes it takes time for you to have that relationship. So it's very, very important. And I thought, well, when I was doing my cover letter, I thought it was worth mentioning that through my experience, I had become somebody who is reliable, who showed empathy, who valued trustworthy professional relationships. So I put that in. So you could put in your own strength. I'm not saying what I'm saying is the only thing that you can prioritize, but put in your own strength. And I think like from yesterday, I spoke about how the best way in which to build, be it a CV, be it a cover letter, be it a resume, is by, I think, looking at the values of the organization you're applying to. The other thing is looking at the 6 C's of care. Those things should guide you. You could come up with a really beautiful, relatable, functional CV or functional cover letter if you do follow that. That's the strategy I use. Even when I go to interviews, I always focus on the values of that organization or what they stand for, and the 6 C's of care. Definitely that is like got me through in a lot of situations. So I went on to say, after just that brief thing, I want to say I am available for interviews at a time convenient for you, and I would be pleased to attend the interview to allow me to discuss further my experiences and qualities in detail. So you see, I what I used was to capture interest of whoever was going to read my cover letter, to say, I've got more. I can't bombard you with like a long list of things, but I do have more that I can actually give, that I can actually tell you in a conversation if you give me a chance, in a very polite way, not in a, but in a very polite way. Capture interest and show keenness to say, okay, engage me, find time and we can have a discussion, and I'll fill you in more on the things that I put up at the top. So a cover letter should be quite short, not too long, because you're writing to somebody that do not know you, somebody that has got other things that they're doing. So don't make it too long, but at the same time capture interest. Put in all the essentials, all the things that you feel like, okay, I need to put these things in. So that's what I did with my cover letter. So I went on to say, also I thought like, well, this is somebody reading my cover letter. They don't know much about me. Why not pop in a few skills? Because some people, it's not everybody who want to go and click I don't know, the attachment on your email to find your CV. So you'd want somebody that reads your cover letter to like get an idea of what they are going to see in your CV if they decide to go that far. So I went on to say, I am document ready with TB test, police clearance, English test, and a full driver's license. My full contact details are in my CV here attached. And I went on to say, many thanks for your time, and I hope to be hearing from you soon. Yours sincerely, Florence. Why I thought it was important, I don't know, it depends with how you feel as a person, but I felt like if given a chance that there's just this one opportunity, I would want that person to know like, I'm ready for anything, I'm ready for this job, I'm ready for moving abroad. So I listed down some of the basic things that are required if one is to move abroad. So I listed down to say, I had my TB test ready, I had my police clearance ready, I had my English test, like my IELTS, and I had a full driver's license. Obviously, you could list to say I've got my passport, but I'd already mentioned that I'm document ready. So I'm sure by that I was covering myself to say I've got everything ready. If you interview me tomorrow and you're happy with me, then definitely we'll be heading to, the visa application center any day. I'm ready. So it's quite important, which brings me to something that I want to quickly share with everybody, to say, if you're going to move abroad, if you're thinking of moving abroad, it's worth noting that it's always essential for you to have like your things in place. Don't wait until you find that job, because I mean, the demand is real. The demand is real. It's not just people from Zimbabwe or people from Africa applying for these jobs. It's people from all over, people from the Philippines, India, everywhere, Middle East. It's the world over. these countries are attracting talent, are attracting skills from the world over. So it's not just you. So make the most for yourself, make the most out of this opportunity. Do not take it for granted and say, well, I'll apply, and once I get my COS, then I'll go and write my English. That chance may not wait for you. So prepare and everything's in place. So that's how I put together my cover letter. And then, so I actually mentioned to say my full contact details are in my CV here attached. So I'm going to go through my CV with you guys so that you have an idea of how my CV looked like. And again, I'll say this. I'm not saying I had the best CV in the world. I'm not saying that, but I tried with my CV and I did it myself, which is why any day, anytime, if somebody asks me what's in my CV, I'll tell them on top of my head. But anyway, for the purpose of this video, I'll be looking and reading so that I can explain to people and so that people can actually have an idea of what I used to land a role in the UK. So it's worth noting that, again, guys, there is templates on the internet. There is, like, if you go on CV Maker or any other application that you use, you can actually come up with a nice CV template. I didn't put my picture on it. I didn't do all the fancy things. Very simple and basic, I mean. So on top of my CV was like my professional profile. So depending on your templates are different, but I will take you through my professional profile. It goes on to say, a compassionate healthcare assistant with expertise in provision of exemplary care so as to maintain the health, safety, and development of elderly people, those with learning disabilities, and those often with complex healthcare needs. That's my opening professional profile. Guys, it's when we say put in the work with your CV, put in the work with your cover letter or your personal statement, capture interest. Capture interest. That one statement can actually give somebody an idea of who I am and how serious I am about what I'm saying I can do before, obviously, they see what I can do in person. So one of the things that I focused on was focusing on health, safety, and the development. So I don't know. I went on to say maintain safe and clean environment using approved infection control practices. Guys, if you've listened to my videos, I said I'm somebody that loves policies and procedures. I do respect those guidelines within the workplace. Why? Because everywhere else that I've worked, I've realized, like, when you do follow policies and procedures, chances you will go far in that organization's chances is you will do everything by the book, and the results are amazing. So I do love policies and procedures. So at every chance I will mention that following procedures. So I went on to say maintain safe and clean environment using approved infection control practices, demonstrate strong leadership qualities with the ability to conduct patient assessment, supervise the provision of safe and compassionate care, and evaluate care effectiveness. I mean, guys, I was selling myself. I still do sell myself. So your CV, your cover letter, your personal statement is a chance for you to showcase yourself, showcase what you can do, show off with that. So that's what I went on to say. I even went on to say acts with integrity and in the best interest of the service user while ensuring compliance with policies and guidelines to promote care home efficiency. Guys, I cannot, this, I don't know, this I'll mention it whenever, policies and guidelines, policies and procedures, I'm big on that one. Also, again, if you check on that last statement, I said in the best interest of the service user. So it says a lot about you as a healthcare professional, as a carer, as a support worker, when you do focus on the patient or on the client or on the service user, depending on the term that you use in your care setting. But it's always it's one of the things that are important in this job, to say the focus is on the person that we are caring for or providing care for before anybody else. Of course, your team is important, your management is important, the organization is important, but at the core, even the CQC, which is a regulatory body in this country, says we go to work to offer person-centered care that is focused on the person we are looking after, not based on the organization's policies or what the organization wants. No, not based on your belief as a person or your feelings as a person. No, not based on what your team would think is right or what your team feels no, but everything is about the person that you're supporting. So I did put that in that statement to say, in the best interest of the service user, and I do feel I did justice with that one. So I went on to mention like the core skills that I have. So we all do vary, our skills are different, which is why I do feel this is just a guideline. I'm not saying go on and use this or this is the best. No, it's just a guideline to give you an insight into what I used to learn the care role that brought me to the UK. So I went on to mention that I've got strong interpersonal and communication skills, patient assessments, caring and supportive and calm, chronic disease management, hygiene and personal care, health promotion and mental health support. Guys, so it depends with you, but I said like what can guide you is the values of the organization you're applying to. That can guide you into the skills that you can, because we all do possess a lot of skills. Like, I don't know, a lot of skills we do possess. So it's always important for you to tailor make your core skills list to the organization that you're going to, what they do and what they stand for. So a big welcome to you all that are just joining us today. We're talking about it's a bit of a continuation from our conversation from yesterday, where I went through with you my application to the NHS, but this is the application that I made when I was back home in Africa and I was applying to organizations in the UK. One of the reasons I chose to share with you guys is because I realized like a lot of people do ask me, like, I do have all the paperwork, I do have everything in place, and I've been applying for a year. So I thought like maybe I could share how I applied. I'm not saying it's the best, I'm not saying, I was just fortunate enough, but this is what I used. So I'm sharing with everybody, I'm giving you an insight into my application. So what I went through first, for those that are joining us, you can always go back on this video. I have shared my the cover letter I used when I was applying. I'm now going through my CV, the one that I used to apply. And one of the things that I said as I was just like going back and counting my blessings was the fact that by the time I came to the UK, I actually like had 3 offers from 3 different organizations, and all of them were free. So it's worth it. It's worth applying. If you're thinking of relocating to the UK, to Canada, Australia, it's worth it going for these things. And this is just a guidance. I'm not saying this is the best. I'm not. A big shout out to you, Terry. I do love you. Thank you so much for the support. So I listed my core skills. So there's a lot of skills. Base your skills on the company that you're applying to, because different companies do different things. Different companies do offer different services. So always tailor make your core skills to what that organization stands for, what they're offering. And also, if you're applying for a care role, be guided by the six C's of care. You'll be good to go. So I went on to list my career summary. So I did put in my career summary to say from such and such a year to date. I started with like current employment, so I put that in. I emphasized on the importance of like doing part-time work, voluntary work, putting in your personal care experience is very important to put it in. Do not underestimate that. So what I did was I mentioned the year in which I started with a company until present. So, and I mentioned the organization. I'm not going to say which organization I did work for, obviously for reasons GDPR, data protection and things like that. So I went on to list what I used to do in that job role. So I said I assisted with patient hygiene, physical comfort, eating, drinking, mobility while observing and reporting specific changes, adhering to patient special diets and providing supplementary drinks under nursing staff supervision. Guys, I think I did say this in my video yesterday to say, keep it simple, keep it relatable. Like, sure that you know what you're talking about. There's no need for like big words, big things that will end up like losing the whole sense. Keep your things simple. Keep your list of like roles very, very simple. You will go far. And always mention, try and incorporate like values, what that organization stands for. Draw your inspiration for what you're going to put, or the wording of what you're going to put from the values, from the 6 C's of care. So that's what I was doing. I say supporting nursing staff with the care of incontinent patients and promotion of continence care. Collaborated with physicians to design at-home medication guidelines and educated patients and families on correct medication administration. It's one of the things that are very, very important. If you're going to work in care, I was applying to most of the companies I was applying to were domiciliary care, and part of what we do in domiciliary care, we do administer medication as carers. Obviously, you get trained, but that's one thing that is different as well. In the hospital environment, we do not do that. The trained staff, the nursing staff, do all of that. So I think I'll make a video on the difference between all these care roles and, you know, what I'm discovering as I journey in my care role. So I did mention all that. I said maintenance and upkeep of patient restrooms and things like that. So one of the things that I want to emphasize is, if you're building up your CV, if you're writing up your care roles, talk about what you do with the patients. Talk about what you do, what the organization you work for requires you to do. Things to do with training, things to do with record keeping and documentation. It's very, very important for you to find a way of factoring that in your CV or in your personal statement. So I did that, and it was basically the same. With what I did is I put down my work experience with a certain organization I was working for that was paid employment. I did put volunteering experience, and it was more or less the same, really. Then I did, this was the CV I'm reading on, is a build up of wherever I go and work, I just add up to my CV. So I actually ended up, like, to date my CV has got like the experience of the organization that I ended up working for within the UK. So so I'll skip on that because it's basically the same anyway. So I'll go on to education and qualifications, guys. It's very, very important for you to put down qualifications that are relevant to the role. Yes, we love your master's degree. Yes, we love your, I don't know, your postgrad. Yes, we love that degree that you have. But is it worth mentioning it in your CV if it's not in relation with the role you're applying for? My feeling is that I don't think it's worth mentioning. That time will come where you'll be asked and you can mention it. So how I put down my qualifications, those that know me, those that do follow me know I've got another background, which is not care, an engineering background, but I didn't put that in my CV. I do not put that in my CV for care because I do not think it's relevant putting it in. So it depends with how you feel and what you think. This is not like everything, but you can build on it. So I did say I had an NVQ2 level equivalent, where I did like my care certificate, safeguarding of vulnerable adults and children, infection control. I do have got my Red Cross nurse aid certificate, advanced first aid. I went on to say I did my A levels, and I mentioned the subjects that I did because I did think that those subjects were relevant to this care role because I did like sciences in my A level. So it could be worth, it depends with how you feel as a person. I also thought, because I'm applying from overseas, definitely it's not so many companies that do understand our education system and things like that. So I thought it was worth mentioning how far I had gone education-wise. So it could be worth mentioning so that somebody has got an idea to say, okay, if we would want to train this person, they're trainable, because I mean they attained a certain minimum education. I know it's not a requirement, I know, but that was how I was thinking as I was putting up my CV and applying. So I don't know, at the end of the day, it goes down to how you feel as a person, and you can build on that. You can also do your own research. Guys, as I do wrap up, because this is going to be very short, I also went on to say additional information. I always say this to say, if you're going to write anything, if you decide to write, I would rather put in more than put in less, because you may not get a chance to be asked what else do you have. So I went on to mention additional information. That's when I went on to say I had a driver's license. But now how my CV reads now is to say I have a full UK driving license. So it's quite important. I did mention that I had a driver's license. I did mention that I had my English proficiency test, which is the IELTS. I had my police clearance available. I had a valid passport. So guys, that's how I was just feeling. Like, I don't want somebody to second guess. I wanted to give somebody enough information for them to decide whether they're going to give me a chance for an interview or not. So I tried by all means in my CV, I tried by all means in my cover letter to give as much information as I could, so that if anybody was going to make a decision, definitely I would want them to make an informed decision. I would want to give them an insight into who I am, what I have, what I've achieved, my experience, my qualifications, so that by the time probably they're making a decision, they are halfway in, they're halfway like interested. So guys, thank you so much for joining me today. I was just sharing with you as a build up and a follow up again from a number of questions that I was getting to say, yes, Flo, you mentioned about like your application to the NHS, but how was it? How did you apply to come from Zimbabwe, from Africa, to come to the UK? How did you get that job? So that's how I applied. And guys, just to inspire somebody, by the time I came to the UK, I actually had like 3 companies that I'd applied to. They'd interviewed me, and they had given me offer letters. So I ended up like going with one of the companies. I think maybe if I do find time, I'll make a video on how then I decided of the 3 which one I was going with. So I think I'll make a video on that one. But guys, these opportunities are still there. These companies are still hiring. So it's worth really giving it your best shot. It's worth applying. You lose nothing. If you don't get to your still life goals, if you don't get the opportunity, life is still going on. If you do get the opportunity, life is going on, and life will start, because life started for me. Life started for me. I see myself growing. I see where my life is going, and I really am grateful. So guys, I think this is it for me today, and I do hope to see you tomorrow. Like I think yeah, I do hope to see you tomorrow. There's a lot really that I want to share with people. I do feel somebody could get helped. So guys, take the time to share, take the time to tag your friends. Let us have this conversation going. One of the things that do inspire me is like it's only now, I don't know, maybe it was happening before, but it's only now that I see a lot of people that I went to school with, a lot of people that I used to go to church with, a lot of my friends, a lot of my family members have moved abroad. So these things are still alive, and people are making lives out of it. I'm not saying if you're in Zimbabwe, life is not moving for you. Life is going for you, but these opportunities could be for you. And a big shout out to all my friends, all my relatives, all my family, all those people that know me, and all those people that do share their stories with me. Guys, I'm so proud of you. I'm so proud of the work that you do, and I wish you all the success. Keep working hard, keep doing all the things that you did in the first place, and go for your dreams. I do trust you with that. I do love you for that, and I cannot wait for you to share with me your stories. Guys, one of the things, if you do have a story that you want to share with everybody, guys, just reach out to me and we can actually do that. And I do hope, I think in a few weeks coming, I've got a few people that have got their stories, and we're going to be sharing here just so that we inspire as many people as we can. There is opportunities enough for everybody. I always love to say I didn't realize like there's so much space, opportunities, and life for everybody abroad. So guys, thank you so much for joining me today. Thank you so much for sharing. I love you, and stay blessed. God bless you. Bye.